Hello everyone, I am Jagruti from Team M3 India. I am welcoming you all for another session of webinar today on the topic of recurrence and management of ovarian cancer as a chronic disease. To enlighten us on this topic, we have our speaker for the evening, Dr. Devavrat Arya. Dr. Devavrat is a Director of Medical Oncology at Max Institute of Cancer Care, Saket, and Max Chemotherapy Day Care Center in Lajpat Nagar, Delhi. Dr. Devavrat completed his DM Medical Oncology, MD Internal Medicine, and also pursuing an online advanced certification in molecular oncology. He has been co-author of several studies and publications. He currently runs the department with other colleagues who are qualified medical oncologists and treat nearly 3,000 patients per month with nearly 1,200 chemotherapy administrations in a month and perform about 20 to 30 bone marrow aspirations, bone biopsies, PICC line insertions. He has successfully completed a project to improve the quality of medical care called Equip India, which was done in collaboration with Tata Memorial Center, Mumbai, and Stanford School of Medicine, USA. Apart from this, I would like to tell you all that this is the live session of the webinar, and I request the audience to post your questions and we shall address them during the question answer session. With this, I'm handing over the session to the doctor, and thank you so much, everyone.
Thank you, Ms. Jagruti, for that kind introduction. And the mandate for me today is to talk about ovarian cancer. Ovarian cancer is a very difficult cancer to deal with. We know that most patients present with advanced stages, and treatment can be really frustrating. But before we talk about ovarian cancer, it's also important to understand what the numbers of ovarian cancer in India are. So as per the Globocan data, and Globocan is a WHO-run organization which tries to create estimates of cancers in different countries. And as per Globocan, we have anywhere between 45 to 50,000 new ovarian cancers being diagnosed every year in our country. Now, that figure may not appear very big, but what we need to understand is that most of these patients present in advanced stages, and unfortunately, we have nearly 32 to 35,000 ovarian cancer related deaths every year as well. So 45,000 new ovarian cancers being diagnosed, and unfortunately 35,000 new ovarian cancer related deaths every year. What's also alarming is that when you look at data from our bigger cities like Mumbai, Delhi, Chennai, Bangalore, etc., you look at the age adjusted rate per lakh population, the incidence of ovarian cancer seems to be increasing. And there is an upward trend in all these registries. And I think one of the reasons why this is happening is we have understood that ovarian cancer seems to be associated with a poor lifestyle as well. It is a disease which is driven by hormones. We see that with greater urbanization, greater adoption of Western lifestyle, average weight is increasing. Dietary habits are changing. We are consuming less green leafy vegetables, less fruits, and physical activity is also reducing. And all of this is contributing to an increased risk of getting ovarian cancer. We can also say that some of these increased numbers are also on account of greater diagnosis because of easier access to scan facilities, easier access to doctors as well. So, newly diagnosed advanced ovarian cancer is the only setting in which treatment is administered with a curative intent. However, once the disease relapses, it becomes incurable. Although with the advances, even the incurable recurrent disease can be turned into a chronic disease. Most newly diagnosed patients relapse within 3 years of receiving standard therapy, and standard therapy in most cases being cytoreductive or surgery and chemotherapy for the high-grade epithelial ovarian cancers. And there has been a clear recognition of the fact that we need to have more effective treatments, more effective chemotherapies, more effective target therapies, better surgeries to ensure that recurrences are minimized and survival is improved. So how grim the data has been traditionally can be seen by this graph. So in one of these studies, when you look at the contemporary progression-free survival and overall survival, so we are talking about women who are living now, treatment now, and this is a study that was published in 2017. On an average, most ovarian cancers, most women with advanced high-grade epithelial ovarian cancers will have a recurrence anywhere between 18 to 24 months. 50% would have recurred. And when you look at survival, the median survival for women diagnosed with ovarian cancer is about 5 years, 67.2 months. And a 5-year overall survival rate is about 55.9%. And this, I think, clearly also highlights the fact that a greater advancement, a more effective strategy is needed. So when you look at the advances that have happened, I think one of the core way of treating ovarian cancer, one of the pillars of treatment of ovarian cancer has been surgical debulking or a surgery to remove the tumor from inside the abdomen. What has added value is chemotherapy, and we'll talk a little bit more about chemotherapy. Chemotherapy after a successful surgery for a relatively earlier stage, a stage 1 or stage 2 high-grade epithelial ovarian cancer. And in those patients who present with stage 3 or sometimes stage 4, where an upfront surgery may not be feasible, chemotherapy before surgery to ensure that the disease shrinks, the inoperable case becomes operable, and then the surgeon comes into the picture, operates, and this is followed by further chemotherapy. What has also been now done is offer maintenance therapy, where once the active chemotherapy is over, these patients would be offered some sort of therapy which is easier to tolerate, like a targeted therapy. And this targeted therapy is given with the hope that the recurrence is delayed and survival is improved. Once